ER will always treat the sickest patients first. So if you get mad because it took so long to see you, that should tell you I was not sick enough to be here. ER does a great job of knowing who needs to be taken care of right now versus who can we wait on. If your ER visit was a long visit, it's because you were not sick. All right, welcome to another episode of Medicine Mondays. Yours truly, Dr. Barry, and we're going to talk about what's the difference between your regular primary care doctor and the emergency room, and when you should decide which direction you should go. And again, I'll be honest, right? 50%, over half the cases in the ER are things that the primary could have taken care of, but because the patients didn't understand, right? And again, as we continue this series on what medicine is getting wrong with patients, as we continue this series, it's this lack of education on when you should go to the ER versus when you should see your primary care doctor. Now, let me give a caveat because I already know someone's going to be in my comments. I understand that if you don't have a primary care doctor, guess what? You're going to either urgent care, I even prefer urgent care. I'll lump urgent care with the primary at that point, with that caveat. But a lot of y'all are going right to the emergency room and sitting in emergency rooms and sitting forever. And then you're mad that you're sitting forever. To the point where now emergency rooms will literally highlight how long the wait time is as like an advertisement. Like, hey, come to our emergency room. You only got to wait 5 minutes, right? Like they're highlighting it. But for lots of different reasons, y'all don't need to be going to the emergency room for every problem. And yes, I'm looking at some of my family members and my wife, right? Like y'all don't need to go see the emergency room for every issue. Like your primary care can do a great enough job, right? But a lot of it, and we're going to talk about it, has to do with effective communication and the patient as well as the doctors recognizing, hey, what is something that needs to be taken care of right now versus something that needs to be taken care of, in an orderly fashion, but doesn't need to happen right at this moment. All right, so let's talk about what's the problem. What is the problem that Dr. Pierre has to do a whole episode on primary care and emergency room medicine? Like, what is that problem? Like, first of all, it's different. The primary care doctor goes through a certain training. The emergency room doctor goes through a certain training. It's there, right? Like, so I don't need to explain the medical aspect of what's different, right? But more importantly, I want to explain, especially from the patient's perspective, what's causing you guys, right? So for one, there's this sense of fear, right? Fear is a big issue when it comes to your health. Again, I appreciate those who are like keeping active. We talked about, we have an episode talking about symptoms and not symptoms. So I appreciate those who have a healthy fear of what's going on with themselves, right? And recognize, hey, something needs to be done. But in that fear, a lot of times there's this judgment of timing. Because we recognize, especially in medicine, timing is everything, but we recognize that like just because you do it faster or just because you think it's going to get to it faster doesn't mean it's actually going to be the fastest, right? So there's this fear, there's a frustration aspect of it. Like let's talk about the person who goes to their primary care doctor, right? And they have an issue and your primary doctor says, okay, all right, we're going to do this test and this test. Go ahead and schedule it out. We'll have a follow-up in 2 weeks. Like there's this frustration that like, what you mean? Like we have a problem, we have an issue, but I have to wait 2 weeks for the results. Like, what are you talking about, doc? Right? So there's that frustration that things aren't going fast enough, right? Because time is a big issue. And that's where confusion get wrapped up, right? And I talked about this in previous episodes. When you are confused, you are anxious. When you are anxious and confused, you make up stories. You automatically have cancer because the story that you've made up in your heap of confusion and anxiety lets you have the worst thing possible. That always occurs, right? So you have fear, you have frustration, and you are confused at what's happening. And because you are confused at what's happening, this is why you think I need to go to the emergency room. Like, no, I can't just wait and call my doctor. I'm not going to do that. No, I'm going to the emergency room. I need to know what's happening now, right? Like that is how y'all be doing, right? And again, I understand, right? I understand it's not y'all. As the patient, it's not you, it's us. we didn't do a good enough job making sure that you guys know, hey, this is what a primary care doctor can handle. This is what an emergency room doctor can handle. Like, we didn't do a good enough job at doing that. And because we didn't do a good job, you guys are sending about a confusion. But today we're going to talk about what primary care folks can easily handle and when you should be going to the emergency room. Because I'll tell you when you should go to the emergency room. I got no problem saying go to the emergency room. This needs to happen now. But you have to be able to kind of listen and recognize for yourself when that's the case. And let me tell y'all something, right? Let me tell you something. When we're thinking about, primary care or emergency room, when we're thinking about these things, this isn't something that only patients experience, this level of confusion. There are people who are in the healthcare system who don't know when to happen, when something should happen. Again, case in point, I work at quite a few nursing homes and some long-term care. I work at a lot of places, right? I'm well seasoned, well traveled. Y'all can see the grades. I'm well traveled in my time in medicine. So I've taken care of patients in the hospital. I've taken care of patients in the outpatient center. I've taken care of patients in rehab facilities, long-term care facilities. I went to patients' house and took care of them there. I've done it all, right? So I see, right, the stages of healthcare. I know what outpatient folks can do. I know what the ER hospital folks can do. I know what the skilled nursing rehabs can do. I know what you could do at home. I know what opportunities are available. But I can assure you that a lot of people aren't as well traveled as me. And I can assure you that a lot of people don't really have that idea of, when this should happen. Quite often I am calming down nurses over the phone who feel that the patient is in front of them, especially in the nursing homes, got to go to the emergency room, right? Because if you're in a nursing home, you live there, right? That's like your primary care spot, except the doctor comes to you. You don't got to go to the doctor. The doctor comes to you for the most part. And quite often I'll get oh, doc, this happened. I think we need to send them out to the emergency room. And quite often I have to say, bump your brakes just for a little bit. There are some things we can do before we get to that point. And a lot of times, especially in healthcare, especially within the healthcare system, there's this self-gratification that, oh, I sent them to the ER and they got admitted, so that means I did the right thing. No, that's not the case. First of all, the ER doctor, I'm not poking fun. Maybe I am. ER doctor is going to admit everything. If they got a chance to admit you, you're being admitted. So it's not a win if you get admitted to the hospital, right? Quite often I'm discharging patients from the ER or discharging patients the next morning because I'm like, all right, you didn't really need to be here, but all right. And I'm sorry, you're about to get this nice little bill, right? That fortunately kind of happens from that sense. So it's not out of the ordinary for even those within healthcare to not know when something needs to happen emergently versus when something needs to happen routinely. And I think those are the two key words: routine versus emergent. When are the things when does it go together, right? When does it all right, I could do this in a routine basis. Oh, I need to happen in an emergent basis, right? That is the case, right? Because what's happening now, right? And my ER docs will tell you, right? Again, like I said, I'm not ER, I'm a hospitalist, right? So I hear them, right? ER doctor feels that they're being overworked, because they are, to the point now where all of them have a scribe. None of them write anything anymore for the most part, right? Because because they're seeing so many patients that there's no way they would actually have time to type up the notes, right? Neither here or there. ER is being overused for things like colds, rashes, medication refills. The wait time is too long. I kind of mentioned earlier in the show where you have some facilities that will promote how long the wait time is, right? What they do is that they have even a little side pocket of mini primary care within the ER, right? Because they know they get so many people that they can quote unquote triage them out and get them out and then decrease that wait time, right? So people are waiting too long in the ER. So people who are sick feel like, I'm waiting forever. I've been waiting forever in the ER. Why do I have to wait 3-4 hours? I got a head cold. Why do I wait 3-4 hours? I'm sure. Why do I have to wait? So ER times are wait long. And again, and this is the big one, right? And this is the big one where it's flipped, right? Because of the concern that you're going to get a big hospital bill, y'all not going to the ER. See, y'all thought I was only going to talk about those who should be going only to primary care, not the ER. No, no, no. A lot of y'all should be going to the emergency room, but y'all not, because y'all so scared of a big bill that you're like, all right, I'll just wait till Monday till my doctor's office coming. I'll try to do a walk-in, right? So it's on both sides. It's important to know what's routine, what's emergent, what needs to be taken care of right now versus, you know what, we can wait till Monday, or we can wait to schedule up your follow-up. We can wait to get your lab. Like, we can wait, right? So I think that is the key at hand, right? Which do you think fills up the ERs most? Emergency rooms or non-emergencies, right? I just want you to just think about that. Pause. Think about that. Emergency rooms or non-emergencies, right? And again, let's talk about the number one mistake people put. Number one mistake that people do that puts their health at risk, associated with not recognizing the importance of that dichotomy of routine versus emergent, right? So first things first, right? So the primary care, right? The way I think about primary care doctor, your primary care doctor is like your home base, right? That's where the routine checkups come in, chronic management, medication refills. That's where, when the early symptoms arise, that's when, what, my primary care doctor has to know, right? And those are the people, right? Because you ever go to an emergency room doctor, the likelihood that you're going to run to the same emergency room doctor at the same time is low, right? Because there's so many of them. There's so many people working, so many nurses, right? But guess what? You go to your primary care doctor, they know you. The front desk person knows you. The CNA knows you, right? The manager knows you, right? Like they just know you, right? They know you. They know your history. So they know what's normal and abnormal, right? So you got a home base with your primary care that you got to take advantage of. But when we think about the emergency room, when am I going to see the emergency room? When something can kill you, right? It sounds self-explanatory. If there's a chance that something can kill you, you need to go to the emergency room. And if there's a chance that something acutely occurs, right? And the biggest one, y'all should know this, is chest pain. If you acutely get some chest pain, you get the worst headache of your life, right? One of these things, you've never experienced it. These are things that says, hold up, I need to find out what is happening like right now. Not when my doctor has an available appointment in 1 week. Not when my home base has an available appointment in a couple of weeks. Not if I go to the walk-in. No, I need to find out what's happening right now. So emergency rooms, again, are typically chest pain, shortness of breath, stroke-like symptoms, of course, any type of trauma, right? You don't want to have any falls or anything and then say you're going to go see your doctor in the morning. No, like you fall, you might break something, hurt, go get the emergency room, right? Because there is a bonus, right? There's a benefit of being able to get things done quickly. Get labs quickly, get imaging quickly, right? Get diagnostic testing quickly, right? Versus the outpatient. If y'all have done outpatient, y'all know, right? Because it's routine, right? We're not expecting y'all to get those lab results the next day and then have an issue the next day. We're not expecting that, right? We say, oh, your pressure's a little high. Boom, take this medication here. All right, come see me in a week or so, or come see me in 3 days, right? Like, we understand that, right? But again, it comes to your doctor being able to educate you, right? That's why I'm here. I'm not your doctor, right? Y'all know that. I'm not your doctor, right? But hopefully I can educate you so when you go to see a doctor, you're like, hey, you know what? Dr. Pierre talked about like certain times I should be coming to see you. Certain times I should go to the ER doctor, right? And these are the times where I feel like I should come to see you. I need a medication refill. I should come see you. I got some nagging little ache. I should come see you. I got chest pain. Boom. I might need to go, right? In fact, call your doctor's office right now, right? And on that answer, if you get the answer machine, they will tell you, hey, if you're experiencing any acute issues, acute meaning happening right now, don't call us, y'all. Call 911. Your doctor is telling you, your primary care doctor is telling you 911. So there are plenty of instances where your primary care doctor knows you should be going to the emergency room, right? So it's not a front to try to battle people against going to the emergency room, right? The emergency room has its benefits, right? But on that same front, we got to know that when the emergency room benefit and risk, right, is too high, right? Like that risk of getting a ridiculous bill because you got a head cold is way too high than the benefit of you, right, getting maybe a medication that night, right, after waiting in the ER for like 6 hours. A lot of y'all, especially, and I always hear this, right, and if put it in the comments if your doctor don't have office hours, after hours. But a lot of y'all can just call your doctor after hours and say, hey, I have this issue going on. What do you think I should do? And your doctor can prescribe medication, send it to the pharmacy. They can do all these things there. Like there's a whole on-call system for that. But quite often, and again, maybe it's purposeful, maybe it's not. Quite often, patients don't even realize that they can call their doctor and have their doctor call them back. I'm talking to the primary care doctor after office hours, right? I'm always on call, right? I'm in a nurse. I work at nursing homes. I don't even have like outpatient office. I work at nursing homes. I'm always on call, right? While I'm recording this, I'm probably going to get a phone call or two, right? Like that just happens. We're always on call. So understanding that you always have access to your doctor. So just because you're doing primary care medicine and you have an outpatient doctor does not mean that after 5 o'clock you can never contact that primary care doctor. You have to go to the emergency room. No, you just need to call the after hours line, wait till that doctor calls you back, and then let your doctor do what they need to do. Your doctor will tell you if you need to go to the emergency room. Your doctor will be like, "Oh, you should go to the emergency room," because I know you, right? You have a history of CHF. You get short of breath, you probably have an exacerbation. Right? You have COPD, you're getting short of breath, you're getting some wheezing. Yeah, you probably should get, the emergency room. Like your doctor, the one who knows you will let you know when it's time to take it behind over there, right? So understand, and then urgent care, right, is, again, it fits that in between some minor cuts and bruises. But again, it's not a replacement for your primary care, but I think it is a better buffer than going to the emergency room, right? Because there's just so many issues with the emergency room, y'all. So many issues with that emergency room. Cost is always a big thing for me. Cost, time, wasted imaging, wasted studies. Like they're always duplicating stuff they don't need to duplicate because, like, hey, while you're here, you're getting radiation you don't need to be getting, right? You're around a whole bunch of other sick people that you don't really need to be around, right? So all of these issues kind of come into effect, right? So a big thing I always ask is this life-threatening or emergency? Take yourself to the doctor. If not, try your primary care doctor. Always call your primary care doctor, right? And I talked about this. I don't care what the hours are. Call them. They have after hours. They're on call. And then again, I always keep like a little a list of things that hands. In fact, what I'll do is I will put a link to a checklist for you guys. So emergency room symptoms, urgent, routine. Like I'll make it so that call your primary for these are routine symptoms. These are urgent symptoms that need you to go. I'll have I'll do a little infographic for you guys for that case, right? So again, and these are some good examples. I like this. If you feel like you got a stroke, like numbness and tingling, you can't speak right, you're confused, emergency room. Don't call your primary. Emergency room. You got a sore throat, you got a little stomach ache, right? And the stomach ache could be different, right? Because obviously, you could be having a appendicitis, but that type of pain, far and above, right? I'm just talking about your regular stomach ache. You had some spicy foods. Go to your primary care doctor. Don't go to the emergency room. You sprain your ankle, right? Like you twisted your ankle. You're out. You try to revive your youth. You're out here playing basketball with young folks, right? You hurt your ankle, right? Go to your primary care doctor. Don't be going to emergency room. What are you doing out here? I think it's important, right? And these are some myths I want to make sure we knock out of here. My PCP is only for annual visits. What? Like some of y'all think the only reason why I should go to my primary care doctor is for the routine checkup. Everything else, I'll let other folks handle. No, your primary care doctor can handle so many things. And you'd be surprised how often your primary care doctor can prevent you from having to go to the ER. A lot of times we'll have medications in our cabinet, like, oh, your pressure's a little high. Boom, take this medication right here. Oh, boom, let me get the EKG for you right here. Like a lot of times your primary care doctor can do a lot of things in their office. Right, you just got to give them an opportunity to give them that chance, right? And then ER is faster and has better doctors. No, ER is faster, definitely not, right? Because again, that's why they have to promote wait times, right? Definitely not faster, especially when it comes to, I could have just called my doctor and got that medication refill. I could have just called, the after hours and got big, but now I waited 3 hours. And now the pharmacy is closed, right? Because I had to wait too long. So again, like this craziness, right? Again, ER will always treat the sickest patients first. So if you get mad because it took so long to see you, that should tell you I was not sick enough to be here. I was not sick enough to be sitting myself in the ER. That's why it took 3 hours to see me. Because guess what? If you're really sick, the ER does a great job at what we call triaging, separating routine, emergent. They do a great job. Boop, 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 boop. If they put you in the routine side, good luck. Go get a book. Go get ready to read a book. You're gonna be waiting there for a while. You get to the emergent side, you're back there quickly, right? So ER does a great job of knowing who needs to be taken care of right now versus who can we wait on. ER does a great job of that. Trust me, I can assure you, ER does a great job of that. So if you have to wait too long, if your ER visit was a long visit, it's because you were not sick. You were not sick enough to be sitting in the ER, and you should have went to your primary care doctor, or worst case scenario called your urgent care, right? So before we get up out of here, right? Before we get up out of here, make sure you like and subscribe, right? I always gotta plug that in there. Make sure you hit the like, hit the subscribe button. We love to see you follow on this channel. But again, I think this is an important factor, right? I think as a healthcare advocate, as your healthcare advocate, right? Shout out to the Lunch and Learn community. Understanding the importance of, hey, you know what? I may need to go see my primary care doctor versus, you know what? Call 911, right? Like, we have to do a better job educating our patients so that they recognize when I should call, when I should not, right? We got to do a better job at doing that, right? And I guess that's why we got this episode, right? So again, I'm yours truly, Dr. Barry Pierre. I'm gonna see you guys next week. Thank you for watching another episode of Medicine Mondays.